Emergency Management, Matthew Pegg. Mayor Tory.
Thank you, Brad, and good afternoon. We are continuing to make progress helping Toronto residents of all ages get vaccinated. Almost 74,000 first doses have been administered to 5 to 11-year-olds in Toronto. That represents more than 35% of all the kids in the city in that age group, 1/3 of all the kids who call Toronto home in less than 3 weeks. And more than 86% of residents 12+ and older have now been fully vaccinated with their 2 doses. We've been taking a calm but cautious and determined approach to the Omicron variant, and as more and more information comes in, we have a plan to prepare and to take action, and that is what we continue to do. The advice from public health officials is clear. We need to roll out as many booster shots to as many people as possible who are eligible as soon as possible. The good news, we're off to a good start on 3rd doses. More than 270,000 people in our city have already received their boosters. That was around half of the eligible population before eligibility opened up further on Monday. Most of the residents in our long-term care homes have already received their 3rd doses in Toronto, thanks to the good, diligent work that was being done to roll out 3rd doses and flu shots. And we have Team Toronto. We have Team Toronto at our disposal, a vast vaccination network that combines our city-run clinics with hundreds of other locations offered by our healthcare partners, by our doctors, and by pharmacies. Building on that strong network, Public Health is working right now with hospitals, community health organizations, doctors' offices, and pharmacies to ramp up vaccination capacity in our city. As you know, we have 5 city-run vaccination clinics that have served as the backbone of our efforts, and they have remained open and remained in operation. We decided much earlier on to keep them open and to keep them operating, which will now help us to ramp up for the booster shots. The booster plan we requested of Toronto Public Health and Chief Pegg will ensure that our clinics go from 23,925 doses a week to 41,140 doses a week, almost doubling capacity just in the city-run clinics as a first step. That plan is rolling out as we speak. 20,000 more appointments have already been added into the system for the city-run clinics, and more will come as we increase hours and capacity, to which Chief Pegg will make reference shortly. Clinics will be operating for longer hours. They'll be operating back at 7 days a week, and we're working to bring in physicians to increase staff as per the province's direction. All of this representing a good start. Our overall Team Toronto 3rd dose capacity is also growing from more than 10,000 doses a day to more than 20,000 doses a day. We're relying on our Team Toronto partners, as we have done throughout, to undertake similar efforts, and we will keep pushing to increase capacity any way that we can. With the announcement from the province this afternoon, we now know that even more people will be eligible starting on Monday. And no doubt, this will lead us to implement even more enhancements to capacity in the coming days. No option is off the table in terms of meeting that increased need and expanding that capacity. We will explore every possible opportunity to ramp up capacity. The Premier is right. This will be an all-hands-on-deck effort to open up as many appointments as possible, everywhere possible, and to deliver as many vaccines as possible, as soon as possible. Opening up eligibility will ensure that every extra added appointment will be used. This is a team effort, and I want to thank everyone who is dedicated to helping administer vaccine doses for the life-saving work that they've done so far, and the work they will now do to make sure that everyone who's eligible is able to get their booster shot, their 3rd dose. What we know about Omicron from public health officials so far is that this variant moves fast. That speed is what likely represents the real problem. And that is why we are rolling out and moving with as much speed as possible to roll out vaccinations of our kids, of those who are eligible for a 3rd dose, and of course, we will continue with our determined effort to reach 90% of eligible adults with at least 2 doses. That is also why we've had measures in place throughout this pandemic to help keep people safe. The health measures we have in place now will continue to help. Today, City Council voted on a recommended extension of the city's mask bylaws. We moved early in the pandemic to make masks mandatory in public places like stores and malls, along with apartment and condo common space. This simple measure has helped to protect people, and I'm confident that Council has extended it based on the advice of public health so that we can continue to provide this protection as we face Omicron. Our most recent conversations with our own medical experts indicate that the greatest risk comes when people are indoors, in close proximity with each other, masks off, often eating and drinking. If this is the case, and I trust their advice, then the course of action we should all take is obvious. As concerns around Omicron continue to grow, and as the media coverage ramps up again, I know people are very anxious. I know that no one wants to feel like they did in the earliest days of the pandemic again, but that they're getting that awful déjà vu feeling. We can't wish away this variant. We have to confront it, just as we have fought everything else that has come our way throughout this COVID-19 pandemic. We will get through this. We have come so far, and we have done so well as a city. We have done that by remaining calm, by doing what was good for ourselves, but also doing what was good for everyone else. Calm, responsible, steady leadership by the people of the City of Toronto, individually and collectively. We need that kind of leadership now more than ever from every corner of the city. Calm, responsible, steady leadership, rooted, yes, in the best medical advice we can get, but also rooted in good old-fashioned common sense. The progress we've made since last Christmas should give us hope. Protecting that progress means moving forward from last year's very solitary kind of holiday experience, but doing so cautiously and carefully. As I've been saying for weeks now, please be careful how you socialize, and please be careful who you socialize with. Please don't go from last year's Christmas dinner for two to a full-blown family reunion all in one. It is not the time for that. It is a time for continued caution. It's just not worth the risk of doing otherwise. And along with being cautious and wearing our masks when we're supposed to, we all just need to get vaccinated and get booster doses when we are eligible. I know that we can do this. I know that we can get the rest of the way there. How do I know that? Because we've already come so far. If you think about it, just think about it for a minute. Literally 1 year ago, just 1 year ago, we administered our first COVID vaccination. A year later, we are closing in on 5.3 million vaccine doses. Almost 90% of eligible adults have received 2 doses. This is an achievement recognized far outside our own city borders for such a large and diverse city. Now, we're going to do it again with boosters. And together, we're going to show, once again, that calm, responsible, steady Team Toronto leadership fueled by hope. Things are better than last year. There is no question about that. Things will be better next year than they have been this year. And I thank you in advance for your patience and for your cooperation and for your collective leadership. And now I will ask Dr. Lamptey to come forward with her remarks for today.
Thank you, Mayor Tory, and good afternoon. During this pandemic, many times we have all been challenged to know what this virus was going to do and how the pandemic would unfold. I want to acknowledge that we all want some reassurance and comfort. I understand the desire for as much information as soon as we can get it, and how confusing it could be to sort out what we know and what we do not know. To protect and promote the health of all residents in Toronto, at Toronto Public Health, we consider scientific evidence and how well the community is able to participate in the actions that protect our overall health. Right now, we see a population where people are fatigued after all the pandemic has brought us. I see exhaustion in the faces of health and public health professionals I work with, who are all driven to advance your health. This also includes the staff of our community partner agencies working so hard to deliver their missions in challenging circumstances. Just a few weeks ago, we began the COVID-19 first dose vaccine campaign for 5 to 11-year-olds in the city. We were looking toward the holiday season with anticipation and hope. In just a few short weeks, we have discovered a new variant that brings new challenges. And while we might rightly feel as though we are done with the virus is not done with us. The immediate future we are facing is potentially different with the emergence of the Omicron variant. I want to tell you that we do not need to abandon hope. As we enter the holiday season, I also want to remind you of Toronto's incredible strengths and resilience that we have demonstrated over the last 2 years. 3 weeks ago, when Omicron was designated a variant of concern by the World Health Organization, my colleague, Dr. Davila, told Torontonians that it was only a question of when we would see the variant in our population, not if. Omicron is indeed circulating in the Toronto population, and the variant is being monitored on local, provincial, and national levels. As of this morning, there were 39 confirmed cases of Omicron among Toronto residents, with many more samples still undergoing sequencing in the provincial laboratories. With that processing time, we expect that number to rise quickly. Not all of the confirmed Omicron cases in Toronto are linked to travel. This means that Omicron is established and we have local community transmission. With any new virus or its variants, there are many elements considered to determine its impact on the population. For example, how easily the virus is transmitted from one person to another, the severity of the illness it causes, and if our current vaccines, tests, and treatments remain effective. It is clear that the Omicron variant is highly transmissible. When we have suspected outbreaks with this variant, we see that the virus spreads quickly when individuals are indoors and not maintaining masking and distancing. As Dr. Moore told Ontarians yesterday, Omicron can infect 4 to 8 times more individuals after an exposure than the Delta variant, and is rapidly becoming the dominant strain in Ontario. We are seeing a rapid increase in cases and our reproductive rate in Toronto. Currently, we do not fully understand the severity of the illness related to Omicron for the entire population. We expect to learn more over the coming weeks. Because of Omicron's high degree of transmissibility and rapid spread, there is potential for a large number of infections. Even a small proportion of a large number could strain our healthcare system. We are observing, both in Toronto and around the world, that 2 doses of COVID-19 vaccine are not as effective against preventing infection from the Omicron variant compared to previous variants. There is new information about how a 3rd dose of COVID-19 vaccine increases the body's immune response built by the first 2 vaccine doses. Given what we know about Omicron's ability to spread rapidly, providing people with as much protection as possible is our leading concern, particularly as we come into a long season where people have increased close contact indoors. At Toronto Public Health, we have been responding to cases, notifying the public when individual contacts can't be identified, and increasing our digital outreach to respond to volumes quickly as we follow changing provincial guidelines. Currently, the provincial guidance is that high-risk contacts of suspected Omicron cases have to isolate regardless of their vaccination status. The more we can slow down the virus, the fewer numbers of people will have to isolate due to exposure. As you heard from the Mayor, we are making every effort to increase vaccination opportunities across the city, including for 1st, 2nd, and 3rd doses. I want to recognize that in the face of this serious situation, we have many things still within our control. Toronto, again, your resilience is remarkable. We are asking you to continue to be part of the response, to protect yourself, to protect each other. Today, I cannot stress this enough. If you are not fully vaccinated or eligible for a booster dose, please get your next dose as soon as possible to reduce the chance of serious illness. If you are not vaccinated, please schedule a dose because this variant spreads so quickly and easily. To protect and enjoy our holiday season, we need to reduce our in-person connections with other people as much as possible right now. Over the holiday season, limit the number and size of gatherings you attend. Reducing in-person contact is the fastest way to slow this virus. That is why Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, has requested that employers ask their employees to work from home whenever possible. What we do now will affect all of us in the weeks to come. Continue to remain home when you're ill Continue to wear a well-fitting, multi-layer breathable mask when you are indoors or cannot maintain a safe physical distance. Thank you all who continue to make good public health choices in an unrelenting situation to keep your households and our community safe. And with that, I'll turn to Chief Pegg to deliver his remarks.
Thank you, Dr. Lamptey, and good afternoon. From the first arrival of the COVID-19 virus in Canada, our incident management system has been responsive, nimble, and scalable. We have worked hard to ensure that we have effective plans in place and that we are able to respond efficiently and effectively as the COVID-19 situation evolves and changes. Since before the arrival of the Omicron variant of concern in Toronto, our team has continued to be hard at work, ensuring that we are prepared to implement whatever action is recommended by our public health professionals. This, of course, includes the operation of our network of city-operated COVID-19 vaccine clinics. We are continuing to operate 5 COVID-19 vaccine clinics located across the city. This includes clinics operating inside the Metro Toronto Convention Centre, Cloverdale Mall, Scarborough Town Centre, Mitchell Field Arena, and the Woodbine Mall. Each of these clinics is presently operating from Tuesday through Friday from 2 p.m. to 8 p.m. and on Saturdays from 11 a.m. to 5 p.m. In response to the emergence of the Omicron variant, I'm pleased to advise that we have already increased the number of doses of COVID-19 vaccine available across the network of city-operated clinics, and we will continue to open additional appointments in the coming days. Of course, this is in addition to the thousands of doses of vaccine that are available each day through our pharmacy, primary health care, hospital, and community clinic partners. On Monday of this week, we proactively opened approximately 100,000 additional appointments in city-operated vaccine clinics, with these appointments being available between December 15th and January 19th. These appointments are already live in the provincial booking system. As of this morning, there were 12,844 adult appointments and 12,943 child vaccine appointments still available in city-operated clinics between today and January 19th. So I encourage you to book your appointment today. At present, city-operated vaccine clinics are operating by confirmed appointment only. Appointments can be booked online by accessing toronto.ca/COVID-19 and clicking the blue Book an Appointment button. Those who prefer to book their appointment by phone can do so by calling the Provincial Booking System call centre at 1-833-943-3900. Tomorrow, we will open an additional 8,800 appointments in the Woodbine Mall Clinic between December 21st and January 19th. We will also be opening additional appointments over the next number of days as we continue to expand clinic capacity as much as possible and as quickly as possible. We will also transition to 7-day-per-week clinic operations as very soon as possible. In total, we are increasing the capacity of city-operated vaccine clinics by approximately 72%, and this is already underway. Once these capacity increases have been fully implemented, we will be able to administer more than 41,000 doses of vaccine each week across the network of city-operated vaccine clinics. Both the Pfizer and Moderna mRNA vaccines are available in all 5 city-operated clinics, including the vaccines for those between the ages of 5 and 11 years of age. First, second, and third booster doses are available in accordance with the eligibility criteria established by the Province of Ontario. In collaboration with our Team Toronto partners, there are a wide variety of opportunities to get vaccinated against COVID-19. Getting fully vaccinated and receiving your booster dose of vaccine once you are eligible is one of the most important things you can do to protect yourself and those around you from COVID-19. As the situation with COVID-19 continues to evolve, our Strategic Command Team will continue to work nonstop to ensure that we are doing all that can be done to save lives and prevent the spread of COVID-19 in our city, and to prevent our healthcare system from becoming overwhelmed. thank you for doing your part to help us win this battle against the virus. And please continue to make toronto.ca/COVID-19 your first choice for accurate, timely, and reliable information on vaccinations and the response to COVID-19 in Toronto. Thank you.
Thank you very much, Chief. We'll now go to questions. Just two journalists on the line today. First, we'll go to Tyson Lautenschlager from CBC News. Tyson, go ahead, please.
Thank you. A couple of universities are halting in-person learning plans for at least the beginning of the next semester in January. York says the first week of classes will be done virtually. Has a conversation taken place with post-secondary institutions to move online if cases keep rising?
Perhaps Dr. Lamptey, you could address that.
Hello, thank you very much for the question. So as post-secondary institutions prepare for the holiday break, Toronto Public Health is meeting with them today actually to let them know about the status of the Omicron situation. The Chief Medical Officers of Health recommendation that those who can work from home, and to note that the situation is changing very quickly and dynamically with Omicron. So with that information, we'll be able to answer questions that they have and guide them as they prepare for the new year.
Follow-up,
Okay,
Tyson?
and yeah, a quick follow-up, also probably for Dr. Lamptey. Some of these plans are being put in place just for a week of virtual learning, and we're seeing some local health units also capping gatherings for just 1 week. So what kind of difference can just that 1 week make?
Well, I think 1 week allows you to get more information about the situation at the time and then evaluate whatever response or plans or changes need to be made. So I think it is prudent to be continually monitoring and adjusting as we go. So I think that's sensible in terms of allowing time to respond to whatever is present, after the 1 week. I think this virus is moving very quickly. The situation could change quickly. But you want to respond with what is current at the time, and allowing a week allows you to do that more effectively, I think.
Okay, thank you very much. We'll go next to David Ryder from the Toronto Star. Dave, go ahead, please.
Good afternoon. A question for, I guess, anybody who can take it. And that is, with this huge number of people who are suddenly going to be eligible and looking for vaccinations, a lot of them for booster shots, but also the other people who are still getting first and second shots. Is there enough resources with city staff and health partner staff? Are you going to have to rely on volunteers? And if so, what if you don't get enough volunteers?
Well, I'll start off, and maybe Chief Pegg wants to pick up. We've shown throughout the course of the vaccination campaign that we will put in place those resources needed to get the job done. And that's why we have administered 5.3 million plus vaccine doses to date. That's why we're approaching 90% of the eligible population that have received the 2 doses, which is something that is, I think, at the leadership level of cities across North America. That is why we've achieved 37% of kids getting vaccinated, 5 to 11 in the course of about 3 weeks. And so if you look at the network that we have in place and had in place throughout the vaccination campaign, thousands of people involved from healthcare partners, doctors' offices, pharmacies. Add that to our city-run clinics, which we're ramping up, as you heard today, and we will not take any other option off the table in terms of putting the capacity in place to make sure that we get the job done. So whether that involves volunteers or not, it's too early to say. There were volunteers involved earlier on, but we will do everything we can, put every resource in place, but we've proven that we can get this job done, and we'll get this one done too.
Chief?
Thank you. Hi, David. Just to build on what the mayor said, I guess the only other comment I can offer is we are literally, our team is hard at work right now, and we are looking at every available option. As the mayor said, there's nothing off the table. So we're looking at every single option that is available to us to make every single dose of vaccine available across our city. But I think it's important to realize and to think about, David, that notwithstanding the important role that our city-operated vaccine clinics play, they are but one piece of the entire Team Toronto effort. And that is a citywide network of resources that certainly leverages the capacity from our pharmacy partners, hospitals, Ontario healthcare teams, community clinics, in this wide variety. As the Premier explained just a minute ago, the provincial booster dose rollout leverages that wide network, and it is going to take that entire Team Toronto effort to get this done. I have every confidence we are going to be able to deliver that, and our team will not stop working considering the things that you have addressed, which is looking at staffing and the opportunity to onboard volunteers and leverage those, as well as everything else, every other opportunity that presents itself.
Thank you. My follow-up is, I guess we're back at the stage of talking about capacity on restaurants and sports stadiums and others. I know the province talked about it today from Dr. Lamptey or Mayor Tory. I guess, are we back at looking at anything Toronto specific? Is there anything coming? Everybody's afraid of lockdown. Is that what we're kind of staring down once again?
I'll start, and then Dr. Lamptey can deal with it as well. I will just say that I hope we're not heading back in that direction. A lot of that is within the control of people deciding how they socialize and who they socialize with, and following common sense and getting vaccinated. But I will also say this. I think it is very important as we move forward to decide what is to be done in this area, that first of all we do as we've done certainly here in the City of Toronto, which is to rely on expert medical advice to make those decisions as to the things that will be most effective to contain and control and manage this virus. And secondly, I think it is highly desirable, in fact essential, virtually essential, that anything that is done be done at least on a regional basis and preferably on a province-wide basis, because the one thing that I think we learned from previous chapters of the pandemic is that confusion on the part of people as to sort of what's allowed to be done, what isn't allowed to be done, what capacity is in place where, is something that is the enemy of being effective in this, at the same time as we can be considerate of trying to have life be as normal as possible for people. And so I would really hope that anything that gets done beyond the measures already in place and some announced today would be done on a province-wide basis, or at the very least a regional basis, but preferably province-wide.
Dr. Lamptey, something to that?
Thank you. I'll just add that my focus today is I want to tell the people of Toronto the situation that we face and give them the information that they can take action right now to change the situation. So I want them to hear and be conscious of the ability to control our future by making individual decisions today and now to protect the health of our community. And that means reducing in-person social contacts. The challenge we face is a provincial one, so I do think that it's best coordinated provincially so that it can be more effective. And we continue to work with the province on a continual basis, monitoring the local situation for provincial solutions.
Thank you, Dr. Lamptey. Thank you all for joining us. That concludes today's availability. Have a nice evening and please stay well.